For all those who are joining us, Rabbi Segelman and I will be discussing abortion this evening, abortion and halacha. We ask very kindly that if you have questions, we are very wanting of them. And at the end, I will give you my email address. Please send me the questions that you have. We will be going through them, and we will probably do another Zoom at a later date talking about the questions that you sent in. This is our third installment of our Zoom halacha calls. Obviously, in the country, the striking down of Roe versus Wade and turning the abortion issue back to the states is on a lot of people's minds. It rings, it never stops. And it is as well, it's on our minds. Tonight, we're going to be talking about how halacha views different situations, different events that occur, and how halacha views them. Now, in halacha, there is no abortion on demand. There also is there's no absolute prohibition to abortion. And we're going to look at cases that have come up, that have come through my office. Some of them are pretty detailed. The patients who these situations occur to, some of them are listening tonight, and they've all been asked before we talk about them that we have permission to talk about their cases without revealing who they are, without revealing every detail. When Rabbanim paskin about abortion, it's on a case-by-case basis. There's never two cases that are the same, although patients commonly come in and said, I had exactly what my friend had, but that's never the case. It's Rabbanim who are specifically trained in deciding on what should be done in these cases. We are not tonight going to review specific sources like you would find in a sefer, going through Torah, going through Gemara, and so on. We're going to talk about, again, cases that came up and how we discuss them. Now, in my office, we have about 1,000 pregnancies a year. 750, 700 to 800 that get delivered, others miscarry, making a total of 1,000. So even things that come up 1 in 1,000 times, we do see them in our office. And during the course of the year, we are on the phone constantly with our Rabbanim that we talk to about these cases, because each one has to live on its own merits and be decided on its own merits. When a situation does arise in my office, I make sure I speak to the perinatologist so I know and understand my view of things, the perinatologist's views, and I speak to the patient's Rav. That's how I do it. But before I ever do that, I call Rabbi Segelman often and go over the case so I'm educated on what points the Rav would like to know when I get on the phone with them. What is important halachically for them to know? So tonight, you're going to see some of the cases that we had. And again, all the cases that we discuss have the permissions of the people who they occur to. That said, I'll turn it over to Rabbi Segelman for some opening remarks.
I think what's first of all, thank you, Dr. Herman. I think that a shiur on this topic at this time, in history, it must be stated, and maybe it can't even be stated enough, that it is a highly delicate, highly sensitive subject, one which carries, just forgetting the political background, but a very, very emotionally driven topic. I'll just share one anecdote. I am the rabbinic director of PUA in America. And before COVID, I was going to Israel to the main office of Pua every year, sometimes twice a year, for a span of a week or 2 weeks, just to learn and to train and to review. And there was a woman who came in the morning, and she stayed in the waiting room, which is typical. People are coming through the doors of Pua in Israel all day. But what was interesting about this woman was that she wasn't leaving. She stayed the entire day. And when I left at the end of the day, she was still there. So the following day, I asked one of the Rabbanim, yesterday there was a woman who was in the waiting room the entire day. Why was she there the whole day? And this Rav told me that the woman who was there the entire day was a woman who had presented many years ago to Machon Pua with a pregnancy-related question. I don't know what the details were, but whatever it was, the psak from the Rabbanim at the time was that she should terminate. And that's what she did. And every single year on the yahrzeit of that termination, she comes to Machon Pua and she spends the entire day davening and saying Tehillim. And again, this was not a year prior or the 2 years, it was many years. It just goes to show that abortion, termination, these questions are not to be taken lightly. And even when medically something is medically indicated or halachically indicated, that doesn't mean that emotionally and psychologically the women are completely there, the husbands are there, the families are there, and it's something which really has to be taken very seriously. As we said in previous sessions, and we'll say again, that we are not paskening halacha during this Zoom call. Dr. Herman and I are having a conversation, and we're so happy that we have listeners. And as Dr. Herman said, you can email him questions. I think you can put on questions on the chat as well. If we can get to it, great. If not, then at a later time, we can address them. But it is important to know that this is a medical / halachic conversation, a scholarly and academic conversation, but not one to be used as halacha l'maisa. And I think with that brief introduction, I'll throw it back to you, Dr. Herman. Let's take it away.
Okay, but before we get there, I want to say that these cases that we talk about, people don't realize what the impact that they have on us as practitioners, and I'm sure on the Rabbanim who have to come up with a psak for them. And we remember them from years and years ago. I think they may have a bigger imprint on us than almost anything that we do.
Yeah.
So just to illustrate the gravity of what's going on. So I put together 8 cases or 8 categories of cases. And out of all of them, the first one, I'm happy to say in some way that I haven't had this happen in my practice. And the first case that I'm going to talk about is where the mother is not healthy, but the baby is healthy. Okay. Where did I get this case from? I got it from the TV show Shtisel. In the TV show Shtisel, Ruchama had some pulmonary disorder that was told if she got pregnant, she would die from being pregnant. And as the story goes, she really wanted to be a mother. And unbeknownst to her husband, she had her IUD removed and she conceived. And as her pregnancy went on, she recorded tapes for her daughter that would be born, that her daughter could play each year to remember and know how much her mother loved her. And she recorded year and year and year after tapes so her husband could give it to her unborn child. So when she was gone, the child should know who she was. And in the end, TV, the mother and baby survived, lo and behold. So our first case is where a mother is so sick that it's really a sakana for her to carry the baby. I think this is probably the most familiar case that the lay people talk about at the Shabbos table, at whatever, and they have very clear opinions of what should happen in this situation. So I turn it over.
The most important detail that we highlight in this question and other questions similar to this is that life of the mother is of the utmost importance. Now that means pre-pregnancy, and that could also mean post-pregnancy, during the pregnancy. Pre-pregnancy, if a pregnancy would cause death or potential danger to the mother, so halacha would very quickly highlight the fact that we have a otherwise healthy woman, and getting pregnant would endanger her life. And just like in every other area of halacha, we are not able to endanger our lives. Our lives are what the Torah says, v'chai bohem, mandated to live by the Torah, not to die by the Torah. We have three exceptions, the three cardinal sins of killing, avodah zarah, and gilui arayos. But other barring those, without the cardinal sins, we have a halacha, a mitzvah, a mandate to live by the Torah and not to endanger ourselves. Risky behavior, right? Risky behavior is a very big topic in halacha. Before kidney donations were mastered, it was a serious question whether it was permissible for a donor to undergo the transplant, the surgery and the transplantation, that to save someone else at the same time they were risking their lives. Baruch Hashem, as the technology has advanced, and it seems like it is absolutely safe. Obviously, there are risks, but that question of risk versus benefit, how much of a risk is one able to take in halacha? So I think this type of question, where you have an otherwise healthy woman and getting pregnant would endanger her life, I think most Rabbanim would take the approach that she should not get pregnant because she is not able to do something which would seriously endanger and threaten her life. We've gotten other shilas, similar shilas, of a woman who, let's say, is a cancer patient, and they find out that she is pregnant, and the chemotherapy, the radiation, whatever process of healing that they have prescribed for this patient would kill the fetus. So I'm shifting to not in a case where she is where she can prevent the pregnancy, but she is pregnant, and you have this clash between the danger of the mother's life, i.e. the cancer, and the refuah, but the refuah would result in terminating the child. And that is that's also a very difficult balance. But many poskim, it's interesting, not all, but many poskim would say what we all would have thought is that we have to do everything in our power to preserve life, preserve the mother's life, and treat the cancer, even at the outcome, the unfortunate outcome of the fetus.
I've had patients come to me before and say, with the blessing of their rabbanim, that I can go ahead and I should go ahead with tying their tubes to make sure they don't get pregnant, because if they did, it would put them in a sakana situation. So that's happened to me a number of times across the years.
Tubal ligation is whenever we're talking about castration and sterilization. So you run into a d'oraisa or d'Rabbanan territory. Female sterilization, according to most Rishonim, is only an Isser d'Rabbanan. So tying of the tubes is an Isser d'Rabbanan. Nevertheless, it's normally thought to be one of the last resorts. Even though it's not a last resort in pregnancy, you can do IVF and you can get pregnant even after the tubes have been tied, because you can circumvent the fallopian tubes. But I agree that in a situation where other forms of birth control won't be effective and you need the tubal ligation, so we've certainly had these fair share of cases. It's always an interesting question. What's better, the usage of a condom or a tubal ligation? If hormonal treatment, a hormonal contraceptive, or all other forms of contraception are out the window. So those are the only two that are left. So which is better? A one-time tubal ligation, or not going with the tubal ligation, but the condom, which you'll have, every act of intercourse is another usage of the condom. Fascinating, Shaila, for a different share.
The next case I'm going to talk about is a healthy mother with a very unhealthy baby. And I spoke to the mother earlier today. I'm again receiving her permission to talk about our case. She said I could use her name, but I won't. And the story went something like this. At 20 weeks of pregnancy, her ultrasound revealed that the baby had a severe heart condition. By 22 weeks, it was determined that the baby would be born alive, but it would not survive, and the life expectancy was about 2 hours. There was nothing that they could do to correct this heart condition. She herself chose to continue being pregnant, although she was told that she didn't have to. And I had the unbelievable experience of sitting with her through labor when Nechama Dalia was born. And after 2 hours, Nechama Dalia decided that she was going to stick around a little bit longer. And she lived 8 days and died on Pesach. The patient is very grateful. The letters that she sent to myself, to the nurses for helping her get through that. She was an unbelievable Kiddush Hashem to everybody who she met. And one of the most exciting days in our office, and we have exciting days all the time, was when she came back and had a healthy baby subsequent. So the case that we're talking about is there's a healthy mother, but a very unhealthy baby that expected to live for a very short period of time. Not to succumb inside, but to be born alive, but then subsequently die.
Heartbreaking stories, but inspiring ones. I have a lot, while you were reading the question, I had a lot of different thoughts that I wanted to share. And I think one of the most important things that we could say at this point is that there is a spectrum of halacha and a spectrum of halachic opinion and attitude towards abortion. And there's also a spectrum of humans and human emotion and human attitude and human desire. And no two couples are necessarily the same, and no two cases are the same. And people shouldn't automatically assume that there is an absolute right answer for their given situation. I wasn't the Rav involved in this case, but let's assume a Rav gave a heter to terminate. So is a couple at fault for not wanting to terminate? Right? If a couple was told that they should terminate and they wanted to live out the pregnancy, to see that baby and just to hold the baby for a minute, an hour, a day, a week, can we tell that couple that what you did was inappropriate? I don't think anyone can say that. If that's what brings them comfort and that's what brings them the chizuk that they need to go on to have a healthy baby in the future, I don't think we could say you are able to and obligated to. Now, in situations where the baby is presenting a sakana to the mother, where the baby is endangering the life of the mother, so then we have to take a different approach because we have to preserve and maintain the life of the mother. But in a case where the mother is healthy and the baby is unhealthy, halacha there are different opinions in halacha. As Dr. Herman pointed out, today's presentation is not necessarily a sheer on all of the myriad of opinions of halacha. We'll point out, just to bring some psak into the conversation, the classic machlokes, the classic dispute between the contemporary poskim is classically looked as the machlokes between Rav Moshe Feinstein Zatzal and the Tzitz Eliezer Zatzal. After all the Gemara, the Mishnah and the Gemara and the Rishonim and the Achronim, it all boils down to the leading poskim of the previous generation, Rav Moshe and the Tzitz Eliezer. Rav Moshe from the Lower East Side, Tzitz Eliezer from Eretz Yisrael. He was the rabbinic authority in Shaarei Tzedek Hospital in Yerushalayim. And the Rav Moshe took the stance that abortion is ritzicha, it is murder. And therefore, Rav Moshe, in almost all situations, did not allow for an abortion to take place unless the baby was threatening the life of the mother, in which case we give a separate category to the fetus, like a rodev, someone chasing after someone else to kill them, where halacha allows us to turn around, habol lahargecha, hashkem lahargo, you get up and you protect yourself. The Tzitz Eliezer fundamentally disagreed, and he maintained that the termination of a fetus, an unborn fetus, is not that of ritzicha, but of something else. And the other poskim discuss what exactly is that. Chabala, is it wounding? All different types of, hashchasa zera levatala. There are many, many different reasons as to why it would be aser, but ritzicha, it's not murder. And this is a very fundamental machlokas, because based on, if you understand it's ritzicha or not, that will give you more wiggle room or less wiggle room to deal with cases other than situations of rodev. So those are the two classical poskim, and so many different opinions in between. It's important to know that we don't have a one-size-fits-all attitude towards termination in halacha. And similarly, there's no one-size-fits-all response from the couple that hears the psak from the Rav. So typically, many poskim who subscribe to the shita of the Tzitz Eliezer will permit a couple to terminate if the condition of the child is not compatible with life. But I think it's a beautiful insight that you shared, Dr. Herman, that just because the couple receives the psak, that the incompatibility with life does permit the termination under these circumstances, but that doesn't necessarily govern how the couple should carry out that psak.
I think also the opposite must be pointed out, where there are a lot of couples under the same situation who would terminate a pregnancy under the direction of their Rav, and then years later express their guilt in doing so. And it's our job to remind them and support them that because we grew up, you don't terminate a pregnancy, that society may have one opinion, but we are empathetic to what they believe and what they feel. And like I said, that's why we go through this with them, because we know that it has implications for years and years and years later. Absolutely. We're talking about termination. We're not talking about termination with happiness, right? And we always have to recognize that.
I'll just share a small story. I was presenting a few weeks ago with Rabbi Dr. Jason Weiner, who is the head chaplain of Cedar Sinai here in Los Angeles. And he mentioned, we weren't speaking about abortion, but it came up that he mentioned that he took a group of students to Cedar Sinai, and I think it was high school students, and they have a wing in Cedar Sinai, the simulation wing, where they train the doctors and they go through the different medical procedures. And he brought the students in, and one of the students said, let's see an abortion. And this is years ago. And he said, you know what? I've never actually done that, so let's do it. Before they did it, they had a class discussion. He was teaching a class in one of the local high schools, and he had a discussion with his students about abortion. Should we give women the right to abort? This is, a few years ago. And there was one girl who was adamant, we should have the right to choose. It's our body. Okay, fine. They had a debate, and then they went in. And he said the technology was so perfect. It was so real. He said he started to cry while they were doing the actual simulation. He started to cry. The members of the class started to cry. They finished, and then they had a discussion after the fact. And she raised her hand and she said, up until we actually went into the room, it was academic. When I saw it firsthand, and this wasn't actually firsthand, it was a computer game, it was a virtual reality. But she saw how intense it was. She said, I retract, and I have to gather my thoughts because it's not what I envisioned. And I think that's also a very important perspective, especially now in the current climate, that there is a person, a woman, a man, a family behind the question, and it's very real, and it's it can be very, very intense. And I think that is an extremely important perspective to bring to the table, especially in today's day and age.
The next case we move to is slightly similar to the second. This one is a healthy mother, but a very sick baby, as opposed to a very unhealthy baby, right? At 20 weeks, a scan was done and the baby was diagnosed with a heart condition. It was determined that the baby will be born alive, will require numerous surgeries, and the life expectancy was somewhere between 6 and 12 years. And this case was brought in front of, again, with consultation with perinatology and Pete's cardiology and Pete's surgery. It was brought in front of their Rav, who after quite a while told them that if they choose, they don't have to continue with this pregnancy. The story was a little while ago, and I'm actually going to leave it like at that point, and I'll ask you for your comments.
My comments are, in a case like that, where we generally throw around these terms of incompatible with life, right? So when I get the shayla, if I were to call you, Dr. Herman, and I would say, Dr. Herman, is this condition incompatible with life? Would you be able to say that it's incompatible with life?
It's compatible with some type of life. The question is what life is that? Right. This child had a very high suspicion that it would never leave the hospital, never be normal, whatever that means, never go to shul, never be in a regular class with other kids. A strain on the family, a strain on the other children in the family, which was actually, I didn't mention, but was one of the big considerations. This was not the couple's first child. The couple had a big family at home. So I believe that they looked at what it meant to the parent, what it meant to this unborn, and what this meant to the family unit altogether in considering giving them the psak.
So I'll share with you two things. Number one, from a strictly halachic perspective, this is a classic example that would really be the nafkamina. It would bring out the very difference between Rav Moshe's approach and the Tzitz Eliezer's approach. According to Rav Moshe, you can't justify ritzicha because the baby is not going to be healthy and they're not going to have a normal upbringing and they're not going to have a bar mitzvah like or a bas mitzvah like all the other ones, and you're not going to be able to walk them down the aisle to their chasana. You can't justify ritzicha for that. On the other hand, the Tzitz Eliezer would argue that the intense pain and burden and trauma that it would present to the family, to the parents, to the family, etc., the strain may in fact be justified. So this is it's a perfect case that would bring out the difference of opinion. But I want to share with you something that happened with me. I got a phone call from a woman who had a sick child at home, and then she got pregnant. She had a difficult child at home, some learning issues, then had a very sick child, compatible with life, but very sick. She put it in IUD, and I remember exactly where I was standing when she called me in tears to tell me that the IUD had failed her and she's currently pregnant. And during that conversation, I was kind of probing, where was this going? Why is she calling me? What does she want? And I kind of threw her the abortion. I wanted to see where she was holding. Is that what she was calling about? And she didn't really bring it up. And then, when I mentioned it very, very tangentially, she said, Rabbi Siegelman, are you suggesting that I should undergo an abortion? Are you? And she said something along the lines of, "Are you crazy?" She's a respectful woman. I have a tremendous amount of respect for her. So she probably didn't say, "Are you crazy?" I don't remember exactly what, but along the lines of, "Are you crazy?"
Right.
And it kind of shook me because that's not necessarily the attitude that I get from other couples, but it was certainly the attitude that she was feeling. Are you crazy? How could you possibly suggest that I should have an abortion? And she absolutely did not have an abortion. And that baby was born, and that baby had a beautiful bris, and that baby's a nice little boy. But what could the projected life for one person, which would be a horror. I can't even imagine what this is going to be like. For another person, it could be a schos, it could be an opportunity to bring a neshama into the world. So I don't have, I won't have as many years as my friends have with their children. And this baby won't live the same life that perhaps my other children would. But do you not think that that I was given the opportunity from Hashem to bring a neshama into the world, to make some type of whatever tikkun was necessary? I've been to many, many shivas of people who are mourning the loss of loved ones who died at a very early age, typically children of theirs. And I've heard this time and time again. People have told me, if HaKadosh Baruch Hu would have told me from the outset, I can give you this child, but you're only going to have him or her for 5 years. You're only going to have him or her for 10 years. You're only going to have him or her for 20 years. And then I'm going to take her or him away from you. Do you want me to give you this child, or should you not have the child? And every single one of the Avelim told me, I'm happy that I had those 2, 5, 10, 20, 30 years with my child, and I'm happy that they're with Hashem now. So again, this is such a delicate and sensitive area, and therefore we can never judge or begin to imagine what someone else is going through, or the attitude that they subscribe to, or the future that they wish to have with their family. And it's for us, the Rabbanim and the doctors, to listen and to be sensitive and empathetic to whatever approach they want to take within the medical and halachic framework.
I constantly have to remind myself that I am the advocate of the patient, and what I would do for myself is very irrelevant in taking care of the patient. My job is to hear what they have to say and then facilitate that. One of the things that I talk about constantly is, I deal with perinatology, and I deal with very often Dr. Chavez, who's at Winthrop. And he's one of the reasons that I'm there.
Good guy, a great, great man.
But I'm going to tell you why he's a great man. And we might have discussed this before. Because when I started and my patients would see him and have issues, he would sit down and discuss, treatment plans, including termination. Now, when he sees the same story, he says, is it okay if I call your rabbi? And Martin Chavez is calling the rabbi on behalf of the patient. He didn't grow up that way. He doesn't have any connection to the community before this, but he learned his opinion goes with the patient, but now his opinion goes with the patient and the patient's Rav. So the next story was and is of a patient of mine who, not the last pregnancy, her last pregnancy, she had a nice baby. The pregnancy before that, I saw her, and at 11 weeks, I did an ultrasound. And I saw immediately that the baby had something called a gastroschisis. A gastroschisis is a birth defect where there's a hole in the abdominal wall, and the intestines are sticking out through the belly, and you could see that on ultrasound. And many times after the baby is born, the intestines could be easily placed or not so easily replaced into the abdomen. And we could expect that the baby will live a healthy life and that the mother will live a healthy life. And with that, and the encouragement of a number of people, she spoke to her Rav, and they discussed termination of pregnancy, that it could be and would be permissible. She again chose not to terminate and proceeded with that pregnancy. But it was an interesting case because here we have a healthy mother and a quote unquote not so sick baby.
I mean, what happens with the baby in the end?
They had difficulties with the baby later in pregnancy.
Mm-hmm. Yeah. The couple didn't want to terminate.
No, they did not.
I've spoken to Gedolei Yisrael, and on occasion, Rabbanim have told me, for certain situations, tell them that they can terminate and that it's a mitzvah to terminate. It doesn't sound like this case would be mitzvah to terminate. And the truth is, if based on the research and their consultation with the doctors and the professionals, if there's a chance that we could save this baby, so we can save the baby. I think that's an important perspective.
I don't know about this specific case, but how, and we'll talk about in a little bit, how much does the mother's mental anguish play into the Rav paskening for them?
That again would depend on the opinion of the Rav Moshe or the Tzitz Eliezer. In fact, the Tzitz Eliezer writes explicitly in his tshuva, a number of tshuvas, the Tzitz Eliezer writes explicitly in a number of tshuvas that a pregnancy that would cause extreme harm to the mother's or family's mental and psychological state, no physical harm, no physical danger, but would be of an intense and an overbearing mental and psychological issue, that would be grounds for a termination according to the Tzitz Eliezer. And what's really important, the important critical conversation that the Rav has to have with the couple is how to properly balance that, especially at a time where the woman is very emotional, where the couple is very emotional. They're in it. You know, it's hard to have that clear perspective without any biases, without any, hormonal manipulation, and here she is faced with this, perhaps one of the most difficult decisions that she's ever had and she ever will have. So that's why it's so important for the Rav to help them think clearly, come to the right conclusion, the conclusion that's most appropriate for them, and being able to weigh all of the factors. But according to the Tzitz Eliezer, as it's written explicitly in his tshuva, mental illness is definitely an important factor.
But I think in this case that I just mentioned, I think the patient didn't feel, obviously, that it was a mental, issue. And probably that's how it was presented, that there are cases that you can terminate. And she surely wasn't told that she has to terminate. That's pretty clear in speaking with her. Case number 5, where we have a healthy mother along with an identified genetic abnormality. And we've talked about these cases. At 20 weeks, a scan was done and the baby was diagnosed with a severe heart condition, another heart condition case. By 22 weeks, it was determined that the baby would not be born alive, that would die inside. In speaking to Rabbanim, they said because it's this condition, they're telling her doesn't even have a 1% chance of survival, that she could go ahead and terminate the pregnancy. Of course, when that was done, we wanted to try to figure out why this occurred. And we try to figure out, will this occur again in the same family? And in this case, we did. We found that both the husband and wife carry a gene that makes it a 1 in 4 chance that this was going to occur with each pregnancy going forward. It's possible that she'll get pregnant 8 times and 8 more times and it will never happen to her. It's also possible she'll get pregnant 8 times and it will happen every time. On average, it's going to be 1 in 4 pregnancies. This patient was given medical options and they boil down to 2. One is to go ahead and do IVF, create embryos, and then choose the embryos that do not have this disease process, that do not carry 2 copies of this abnormal gene. Or she could get pregnant, and early in pregnancy, we could test the baby, right, through a CVS or through an amnio, and learn if this baby is one of the children that will not survive, and then terminate that pregnancy, or find out that this baby is one that will survive and let the pregnancy go on. We have a couple of different cases of this. And in one case, the patient was told that she should undergo IVF. In another case, a patient was told that she could get pregnant and terminate a pregnancy if it's found that that baby, with invasive procedures, right? Taking some type of risk with invasive technology to see if that baby has the disease or not. So that's the case that we're talking about.
It's a very difficult balance. And from a halachic perspective, you'll find opinions, reliable opinions on both sides of the coin. You'll have rabbanim that would certainly not allow them to get pregnant naturally and would require them to only get pregnant, would only allow them to create embryos, not to get pregnant naturally, and to create embryos that can be screened and transfer only healthy embryos, completely circumventing the question of termination. Of the rabbanim, you will find reliable and competent poskim in the Orthodox community that would allow the couple to undergo a natural pregnancy and then a CVS. And should the CVS come out that the baby is in fact sick, to permit the termination. I think, like we've said in this session, just to remind ourselves how difficult an abortion is from the psychological perspective. And from statistically speaking, it's unlikely that she'll have 4 of these sick pregnancies in a row, 5 of these sick but it's possible. So for a woman to have to undergo such a treatment, pregnancy after pregnancy after pregnancy, can be so emotionally taxing. So it's physically taxing, but so emotionally taxing that I question whether that would be a good eitzah. We have the technology available to do IVF with PGD. It's no walk in the park. It's not cheap, but at least it would present the avenue which would rid us of all halachic shilas of abortion, and it would prevent us from having our hopes up when we get that positive pregnancy test, and then our hopes crushed when we find out that in fact the child is ill, the fetus is ill. So that's my personal opinion. However, as we've spoken about in the past, I'm close, very close, and have a very, very beautiful relationship with 2 rabbanim, with more than 2 rabbanim, but rabbanim leading poskim. One of those rabbanim will tell you to only do IVF with PGD, and that other Rav will say, go ahead and get pregnant and do the CVS. There was a talk a few years ago about trying to do the CVS at day 36 of the pregnancy and have the results in before day.
There was a doctor in Manhattan that did that.
In NYU.
And then he stopped.
But he does. I think he does it under the table sometimes. Okay. But that's an interesting thing because here's a little insight that we haven't discussed yet. The different stages of pregnancy, and does that matter in halacha? According to Rav Moshe, it really makes no difference at what stage we're talking about. But the Gemara does differentiate between the first 40 days, maybe the first 3 months, the first 40 days before before maybe there's obviously genetic, material as of conception, but up until day 40, there's still, from the very beginning stages of the proteins developing, that's one stage in halacha, which the Gemara says in Yevamos is maya ba'alma. It's like just like water. It's really insignificant. Now, the post can point out that doesn't mean insignificant, and therefore an abortion is totally up in the air, no questions asked. But there is a concept of before 40 days having a little bit more of a lenient approach than after the 40-day mark. So if we could have this CVS...
40 days is 54 days from the last menstrual period.
Correct. Real in halacha. So we did a nice research study because it's based on the Mishnah that talks about the development of the different features. So it could be even up to 7 weeks and 4 days. 7 weeks and 4 days. We could say that's within 40 days. But that being said, if we could theoretically have the CVS completed and the results in before day 40, so according to some poskim, that would make it a little bit easier to swallow, make the pill a little bit easier to swallow. I'm not talking about the pill that
Yeah.
But again, someone like Rav Moshe and Rav Moshe's camp would not allow for such a thing.
So let's take that same case where the patient comes back, she gets pregnant, and they determine that this baby is not normal. And she's going to terminate the pregnancy. And she turns to me and says, "You are my doctor. You've gone through all of this with me. I can't see anybody else doing this termination of pregnancy other than you." And I tell her, the truth is, I've never done a termination of pregnancy. I have no desire to do that. I have the desire to make sure that you're healthy. I'm going to get you somebody competent, more than competent to do it. I will walk with you to the operating room. I will be in that room the whole time, and I will leave the operating room with you. But it's my choice not to do it, both halachically and personally. I never had to, so I don't. And then they say, "Well, who are you going to get?" And I said, "I have this doctor," and he goes, "Is she Jew? Is he or she Jewish or not?" What is halacha about who should terminate a pregnancy in this case?
Fascinating question.
A lot of talk about that.
Fascinating question. A fascinating question. We grow up, with the phrase of the Shabbos guy. If we can't do things ourselves, we're uncomfortable with doing something ourselves for whatever reason. Al yidei nachri, let a goy do it. Perhaps logic would dictate that we should ask a non-Jewish doctor to carry out the termination, because let the goy do it. What's interesting in the sugya of abortion, of termination, is that with the Sheva Mitzvahs B'nai Noach, that Goyim are, the non-Jewish world is obligated to adhere to the 7 Noahide laws. One of the laws is not to kill. And the Gemara in Sanhedrin clearly differentiates between the Isser, the prohibition of killing for a Jew and a non-Jew. And the Gemara says that a Ben Noach is Musharin Afil ala Ubrin, that they are obligated and warned not to kill even Ubrin. And in Ubar, an unborn fetus would be a violation of that, according to for a non-Jew, punishable by death. It's a big deal. Whereas there's an Isser Ritzicha for a Jew, according to Rav Moshe, there's still be an Isser Ritzicha for a Jew, but it wouldn't be the classic case of Shvichas Damim that Beis Din would put you to death. Therefore, when you weigh it, it seems pretty clear that the Jewish doctor should be the one to carry out the termination, as counterintuitive as you'd think. But the Jewish doctor, the one who's not, doesn't have the more machmir law of Ritzicha by Uberim, that the Jewish doctor should be the one to do it. I believe that Tzitz Eliezer actually in his tshuva recommends that a Jewish doctor carry out the abortion. Halacha l'maisa, if you can have a Jewish doctor, matov u'manoim, that would be better. If you don't have access to a Jewish doctor, so the poskim write that it is permissible to use a non-Jew.
It's very interesting because in my mind, I was always brought up to believe that the Jewish doctor shouldn't be the one to do it.
Right.
The person I've talked to has always told me that was the case.
Right. But B'nai Noach are chayiv al ubrin, and Jews are not.
Yeah.
That being said, the same thing I said to the couples, I'll say to you, Dr. Herman, if you don't feel comfortable, so then you don't feel comfortable. I admire the dedication and the compassion that you have for your patients, and you'll hold their hand throughout the process, and that's a very beautiful thing. And the support that you give them is equal, probably equal to, if not greater, of more importance than the one who carries out the actual procedure. But again, from a halachic perspective, there is certainly a reason to request the Jewish doctor over a non-Jewish doctor.
That same case, the patient comes, she's now 20 weeks pregnant, and we determine that baby has the genetic abnormality and is not going to survive. There are two different basic types of terminations. There's one called the D&E, where we go to the operating room, and they operate, dilate the cervix, and remove the pregnancy. There's another one where we take the patient actually to labor and delivery, and we give her medication, and she delivers the baby. Is there a halachic preference of one over the other?
That's a very good question. There is a discussion in halacha about kind of the method of termination, if it can be done in a what's called a grumma fashion. It's not. It's done in somewhat of a help me out over here. It's an indirect form. Taking a pill, ingesting something which has some type of bodily response, which will create a toxic environment for the baby, for the fetus, and then the fetus will die, is different than going in and puncturing a hole in the heart and injecting some type of toxic material into the baby. You see, there's a big difference. When possible, halacha prefers a patient to try and undergo the most indirect form, if that's possible. If it's impossible, so then whatever is medically indicated, whatever is the most appropriate medically speaking, I think that's what they should do. But there definitely is in the poskim would say there is an attitude that the best way to go about it is, to borrow the phrase from Yom Kippur, hakal tchila. We go for the bottom, the most lenient, and then we'll go from there. We don't tell a woman just to break her fast necessarily on Yom Kippur, right before drinking shot glasses. So that's a separate shir. Everyone's invited back to the pre-Yom Kippur shir. But hakal tchila. We'll start with the most removed, most indirect form, and if that's not an option, so then we take it from there. But if possible.
So I'm still a little unclear. Which one would we choose if a patient asked us that? If we're saying that roughly medically they're equivalent, one woman you put her into labor, the other one you take her to the operating room. Is there anything to be said about kavod for this baby that you'd want it born intact as opposed to surgically? Do we have any concept like that?
That's an interesting question. You see from the Mishnah in Olos that where the Mishnah is talking about the baby which is presenting a danger for the mother. So there, the Mishnah uses that gruesome and graphic, language of cutting up aver by aver. So you do find that if it's in fact posing a threat to the mother's life. I think that there are important considerations here. Number one, not so much of kavod hames, but perhaps kavod hachayim. to make a woman go through labor and knowing that this baby is not going to be crying when it comes out, it can be very, very traumatic. And perhaps the patient, for that reason, would opt for some type of surgical procedure as opposed to going through labor.
But I'll tell you why a lot of women don't choose that.
Okay.
It's because the labor, once they make a decision, they want it to be implemented right away. So they want to go to labor and delivery into a private room with the trained nurses who deal with this and start the process, where the surgical approach might take 3, 4, or 5 days even to get on the schedule. So we've clearly had patients who we've set up for the D&E, but then turned right around and said, I want to go right now and be taken care of right now. So they have different preferences, different
preferences. I think either is okay. There is in Halacha, there is a case, there are a few cases that I've seen where the Rav has permitted the abortion, and told them that the way that they should do it is just by inducing labor right now. Right. And the baby will, the baby won't make it. But it's better than, let's say, going in and cutting up or injecting something into the baby. But I think it's a very, very emotional and sensitive issue, and I think that the patients should make the decision that feels most comfortable for them. From a halachic perspective, the labor may be most appropriate, but I don't think it's necessary. Should they feel uncomfortable with that?
Okay, number 6 out of the 8 different types of cases. Healthy mother, healthy baby, but the baby has an abnormality that's going to affect its future reproduction. What am I talking about? I'm talking about 2 cases. The Klinefelter, you identify that this baby boy has Klinefelters and in all likelihood will not have sperm when he grows up and will not be able to reproduce. And the Mayer-Rokitansky-Kuster-Hauser syndrome, that's the female that's born with the absence of the uterus. So she can't carry a baby, although she does have eggs that another woman could carry. After these diagnoses, the patient turns around to you and says, wait, I feel very strange carrying this baby. These children are not going to be like other kids. They're always going to be labeled. They're always going to know there's going to be a problem for shidduchim. How could they ever get married? And all the things that come with it. So a slightly different case.
All I can do is share with you my perspective.
Yep.
Given my role at PUA,
which I think is my perspective also, but yes.
I have seen so many wonderful young men and young ladies who are Klinefelter patients, who are Rokitansky syndrome patients, who are the most beautiful and inspirational people. And the thought of those people not being brought into the world because their parents were concerned with their shidduchim or for their future grandchildren is disturbing to me. Beyond that, at least with Klinefelters, not every Klinefelter patient is absolutely azoospermic. There are Klinefelter patients that even if they don't have sperm in the ejaculate, they'll have sperm in the testes and will be able to do IVF and have children. So, with Klinefelters, yes, they have a genetic issue. They have an extra chromosome. And yes, fertility will be significantly more difficult than their friends in yeshiva. But they can be wonderful people, and there are a heterim for sperm donation as well. They cross that bridge when they get there. But Rokitansky syndrome is a little bit more complicated. Surrogates are out there. Hopefully uterine transplants are out there. So, my perspective is those are potential beautiful neshamas and beautiful people that I enjoy meeting with on a pretty regular basis. And it would be sad to me if those people were never here.
I very much agree. Slightly on the same topic. amniotic band syndrome, where there's a band of that goes across the uterus, and an arm gets caught up in that band, and the arm doesn't grow. And now you're looking at a baby inside that's going to come out, and it's going to come out without a leg or without an arm due to a situation that occurred. And the mother says to you, I don't want to give birth to a baby that's going to have a visible abnormality that's too hard in today's world.
No leg. That's pulled together.
There is a discussion in Hilchos Shabbos. There is a discussion in Hilchos Shabbos. I think it's in Siman Shin Chav Ches, Sif Yud Zayin, that talks about Sakonas Aver. Let's say a person is in a situation on Shabbos where their life is not in danger, but a limb is in danger. Sakonas Aver. So are you able to violate Shabbos to protect and to save that limb? What would be an example? A person gets into some type of accident and a finger is cut and is, without getting too graphic. And if you're able to get the surgery now, if you go to the hospital now and you're able to get the stitches in the surgery now, we'll be able to keep that finger. If not, the finger is going to fall off and you're going to have without a finger. Pick the limb. So there in Sif Yud Zayin, the Shulchan Aruch brings two different opinions about Sakonas Aver, whether you can violate a D'oraisa on Shabbos. We know if a person's life is at stake and in danger, on Shabbos, you're allowed to get in the car, turn it on and go. If there's no other way to do it, you got to do it. You got to break Shabbos. We save lives. Hatzalah does tremendous work even on Shabbos. But what about Sakonas Aver? That same machlokes, or the same idea presents itself with abortion as well. There are poskim, believe it or not, that say that Sakonas Aver is also a sakana. We would break Shabbos to save that Aver, and therefore the fact that we can break Shabbos, we should also treat this as a pikuach nefesh. And other poskim who disagree, and they say that whatever the response is, that it's not significant enough, or the aesthetic issue can be dealt with with different surgeries and cosmetic surgeries and whatnot. This would be a very obvious difference between Rav Moshe and the Tzitz Eliezer. I think we would have to weigh the couples their attitude towards the situation, and they should be counseled very carefully and closely by a competent Rav who is familiar with whatever the issue is and what the potential remedies are, at least aesthetically, for the situation.
The next case that I want to talk about is a mental and a physical crisis. And I'm going to read an email that I received, and I bet you it took this patient 2 hours to write this email. I'm very embarrassed and guilty to explain my situation, but at this point I have no choice. A few weeks ago, I came in and we confirmed a pregnancy. It was determined that I was about 5 weeks and 5 days pregnant at the time. I have beautiful children, and I wish I could have a dozen more, but for a variety of reasons, I could not continue with that pregnancy. I'm sure you remember how sick, severely dehydrated I was in previous pregnancies, how I received IV fluids at home, and even had a PICC line after being admitted to the hospital. Considering my age, the effect each pregnancy has had on my physical health, my mental health, my marriage, and my existing children's well-being, I was completely desperate. I spoke with Rabbi A, and I also spoke with Rabbi B, and I received a heter to go ahead with an abortion. I feel horrible and guilty, but I know that I would not have survived that pregnancy with my physical and mental well-being intact. Reading this, like I said, it must have taken her 2 hours to write it. It's just a little window into what this woman was going through. And she proceeded and had a D&C performed. Well, as a side thing, is it preferable to do a D&C, or could she have used pills to make her have a termination of pregnancy? If she had a choice, which one of those would be preferable, which is very different than the case that I asked you before, using mifeprex.
Yeah.
And this is earlier in pregnancy.
I think
So
the
she's
pill,
7 weeks.
from my impression from a medical standpoint as well, I think that the pill, I think, would be the first choice. And I'm interested to hear your perspective. Would you recommend the pill over a D&C? Therefore, you avoiding potential scar tissue and uterine trauma?
In general, it takes like 7 D&Cs before we really see that. Obviously, there are exceptions, but on the whole, we learned a lot from Russia where they used termination as birth control, or at least that's what we were told. And they determined that it takes 7 of them before we really see an effect. The big difference to me is the medication, when they take it, they miscarry at home, have cramps and so on, their kids around, it's very uncomfortable. With a D&C, they get medication, they go to sleep, they wake up, and it's taken care of. So mentally, a D&C might be easier and just as safe. The D&C could be done later when pills aren't effective anymore.
Right, correct, that's true, for sure. I think that what I took out from this question is is twofold. It's kind of the attitude from the rabbi's perspective as well as the patient's, and that is patients should know and feel comfortable taking the psak from their rav. Especially here, she consulted 2 rabbanim, and both rabbanim permitted her to terminate. So obviously, halachically, it was permissible, and she shouldn't feel, I can't say she shouldn't feel guilty. Guilt is a natural human, emotion that people experience. Who am I to say don't feel guilty? But that, for what it does tell me is that it tells me as a rabbi the tremendous responsibility that we have towards the patients, towards the couples, to not just deliver a psak, to render a psak and to hang up the phone, to close the door, and forget about the couple or forget about the question and move on with our lives. But the importance that the Rav should have in this couple's lives, and the support, sometimes ongoing support that the couple needs. Now, every couple is different. Some couples would not appreciate the rabbi checking in every so often. How you doing? How are you doing? They would prefer if the rabbi stay in his lane. And other couples are so touched when the rabbi reaches out and say, I'm just calling to see how things are going. Anything on your mind, I'm available to talk. Everyone is different, but it's important for it to be on the forefront of the conversation in our minds that this is not, as we said in the beginning of today's session, this is not a one and done situation that we forget about it and we move on. It's something which is real. It's something which sticks with us. And from an emotional standpoint, from the support standpoint, Rabbanim and medical professionals as well should be there to hold their hand and more.
When I spoke to this patient, I very gently spoke to her about using the words embarrassed and guilty when talking with me, and that I reminded her that I am here for her and that she should never feel embarrassed and guilty, that she should never have to go to somebody that she didn't know to help her, because we're there for her. Another thing that came very clearly to my mind is what you read in the lay press about, and I'll say it this way, the big bad rabbis in the Orthodox community with no heart and no feeling, and making abortion illegal. I think this is the ultimate representation of how our rabbanim are and how they treat patients and life, the pregnancy and the patient and their family. And that was one of the things that I took away from or thought about when I heard this specific story, because it was right in the middle of all of this that's going on in the outside world. And, maybe I wish a little bit that the outside world could see how we operate and get rid of the idea, oh my God, look how the Orthodox rabbis are taking away women's rights and so on, where this is clearly a representation of that's not the case.
Absolutely.
One last case, a very disheartening and distressing case, is a 28-year-old woman called me, not married anymore, and she had an unwanted sexual encounter, which is another word for saying rape. She was raped and discovered that she was pregnant, and went ahead and had a termination of pregnancy. Related the story to me. And one of the things that she said is, in all this crazy situation, I fear what the Rav would have told me. And I reassured her that she could have, would have, and should have spoken to the Rav, and the Rav certainly would have helped her in this situation. How does Halacha and Rabbanim look at the mother is healthy, the pregnancy would be healthy, but this mental crisis is like none that you could ever understand and experience?
Yeah, unfortunately, it's not a new shaila. It's a shaila that's discussed in the poskim already. I'll just, I'll just share with you a few, I've gotten all of the shailas from random rape cases where the woman was just in the wrong place at the wrong time and bam, to family members, lo aleinu. So the general approach from the poskim is to permit an abortion as a response to rape. Some rabbanim say anytime the baby is a mamzer, anytime the baby would be mamzer. In this case, parenthetically, she would not be a mamzer. The baby would not be a mamzer because the woman was a divorcee. She wasn't a married woman at the time. There are many different approaches in the poskim. And without getting into the specifics, what I would say is just something that you said in the beginning, that this question is a question that we are raised. This topic of abortion is a topic that when we're raised as children and even adults, and sometimes even well into our adulthood, we are taught that abortion is never permissible at all under any circumstance. And perhaps it's coming, out more clearly now than ever, with the various statements that the OU put out, where we remind Klal Yisrael and the world that our approach is way more nuanced than that, and it's offensive to assume that the halachic approach would be so simple, to be black and white, yes versus no. Our beautiful halachic system and the delicate nuances and the sophistication of the psak and the sensitive and empathetic outlook that we have towards each person in the picture creates a psak which is always going to be the most appropriate for that situation. And luckily, usually in the case of rape, the victims are able to and are told to terminate, and then given the support that they need to overcome the traumatic experience. But unfortunately, it's not an uncommon shaila, and we pray that this type of terror should stop, and we shouldn't hear these shailas anymore amongst our brethren Bnei Yisrael.